this over. Thank you for joining us today, Ed. We look forward to your presentation, and we would love to hear a more formal introduction on who you are and where you're from. And thank you again for joining us today.
Thank you, Red. My name is Ed Guy. I will say that Edward usually makes me feel like I'm in trouble, and that's what my mother called me when I was in trouble. So I'm Ed. Couple things. Yeah, please feel free to ask questions. You can type them into chat, and we'll see how we can answer those. If I don't know an answer, I will ask you to shoot me an email, and I'll get back to you with an answer as quickly as I can. About me, as Rhett said, I've been in the environmental health and safety field for about 35 years, which kind of stuns me, but after college, back in the dark ages, I worked in the asbestos industry, doing a lot of inspections of school buildings. That was the heyday of the AHERA period. Wrote a lot of management plans for schools, and then transitioned into higher education as a environmental safety specialist, doing basically everything, OSHA, EPA. I was in New York State, so we did a little bit of everything. So like everyone else here, I'm having a wee bit of technical difficulties. 17 years in higher education, and the last 10 and a half until I retired at the end of the year, I was with L&I's Division of Occupational Safety and Health, which we call DOSH. The first 2 years, I was an industrial hygienist doing compliance inspections, and then I transitioned into the supervisory position, where I led a team of 5 hygienists in Region 3, which is Pierce, Kitsap, Clallam, and Jefferson counties. So I've seen quite a lot of stuff. I do want to say that the opinions I express today are mine. I am not representing L&I. So, that's just a legal disclaimer I felt I needed to do. One of the things I used to say when I was doing inspections and dealing with employers was explain the difference between hygiene and safety. And what I would say is that hygiene is what can make you sick or kill you, versus safety, which is what can hurt you or kill you. So that's hygiene versus safety in a nutshell. But today we're going to talk about bloodborne pathogens. And this is not, a DOSH regulatory training. This is just kind of a high-level overview. So when people think about bloodborne pathogens, they think about things that cause HIV or hepatitis B or C. Bloodborne pathogens are diseases that are found in, and I'm hoping everyone can see the presentation. Please let me know if you don't. Okay. Bloodborne pathogens are disease-causing microorganisms found in human blood and other body fluids that we call other potentially infectious material, OPIM. Diseases that we talk about most commonly, as I said, are hepatitis B, hepatitis C, and human immuno. I always struggle on that one. HIV. So what are the other body fluids that make up OPIM? They're any unfixed tissue or organ other than intact skin. So in the unlikely event on a construction site, you have an amputation, a table saw, a circular saw, that detached body part would be considered OPIM, and it'll also have blood, of course. Semen, vaginal secretions, fluids of the brain, spine, and body cavities, saliva with blood. You see that a lot in dental work. Amniotic fluid. So if a pregnant woman's water breaks, that fluid is amniotic fluid, and that is considered an OPIM. Any body fluids with visible blood, and if you don't know what the fluid is, then you have to treat it as OPIM. Hepatitis B. There's a look at the virus. It can survive outside the body for quite a while, 7 days in dried blood. It's 100 times more contagious than the HIV virus. And the disease, the illness can range from a short-term mild illness lasting a few weeks to a serious lifelong illness. There's no cure, but there is a vaccine available, and we will talk about that later. Those who have chronic hepatitis B are more likely to develop liver diseases such as cirrhosis or liver cancer. So being vaccinated for hepatitis B is fairly important if you have occupational exposure to bloodborne pathogens. Hepatitis C, similar, is the most common bloodborne infection in the US. 2.4 million people being infected, and this is a low number because many people are infected with hepatitis C and don't know it. So you get about 1,700 or 17,000 new people getting infected every year, and about 12,000 people who die from hepatitis C effects every year. Again, ranges from a mild illness lasting a few weeks to serious lifetime illness. Fortunately, there are now drugs that are available to treat people, and with a course of treatment, they can actually now be cured. You see these ads on television a lot, so that's where most people are familiar with them. Human immunodeficiency virus, HIV. This is actually a picture of the virus. The good thing, not nice, the good thing about the HIV virus is it's very fragile. It only survives for a couple hours to a few once it's outside the body and it gets into a dry environment. It attacks the human immune system, specifically a type of cell called the T cell that is really kind of the first line of defense in the body's immune system. 1.2 million people infected in the US as of 2022. Again, this is in all likelihood a low number. You know, many people might be infected and not even know. HIV virus causes AIDS if untreated. HIV and AIDS are not the same thing. HIV, you can have HIV and that means you're infected with the virus. You only have AIDS once symptoms start to show up, which can be years later. There's no vaccine yet, but there's a plethora of drug treatments now that significantly prolong the lives of infected people. One I always think of is Magic Johnson. I mean, he's been HIV positive for decades. So there's a lot of hope for people with HIV. Additional diseases that can be caused by bloodborne pathogens. Arboviral infections are infections that are caused by insect bites. Um, Eastern equine encephalitis, uh, Zika, um, um, Ebola, uh, even syphilis is considered a caused by a bloodborne pathogen. Um, so there's quite a range of additional diseases. You might remember the Ebola and Zika incidents that we had in the in the southeast of the United States. In the Pacific Northwest, we have West Nile virus, which is a concern every year. How are they transmitted? Workplace injuries. Someone who might be, have one of these diseases, gets hurt on the job, and there's blood. If other people interact with that blood, they could potentially become infected. Providing first aid is a big one. If they're providing first aid and they have a break in the skin, and they're not wearing gloves, that's definitely a potential for transmission. This is really important that people who are doing first aid on the job, and actually first aid anywhere, wear gloves. That is to help prevent the transmission of these diseases. Contaminated instrument injuries is a fancy way of saying, getting stuck with a dirty needle or any other potential item that's contaminated that can puncture your skin. You can get it through your mucous membranes if you're splashed. Of course, sexual contact. Hopefully, we're not having that on the job sites. And injection drug use, people sharing needles. Workplaces where bloodborne pathogens may exist, medical facilities, hospitals, doctors' offices, dental offices. And I mention these not so much because while those people who work there have occupational exposure, for contractors and others who are working in those facilities, you want to at least have some familiarity with what's going on and procedures, so that they are protected and also feel comfortable. Hotels and restaurants. When I was inspecting, it wasn't uncommon to go into a hotel and have the housekeeping staff talk about, finding needles in rooms, of having to clean up blood or other fluids. Same thing with restaurants. Construction sites and vacant buildings are another one. Again, we had instances where we would go to construction sites, particularly buildings that had been abandoned, where perhaps squatters had been, and it would be fairly common to find discarded, contaminated needles and syringes there. So, if you're doing that kind of work and your people are finding needles, it's something you need to be aware of and deal with. I want to talk about sharps for a minute. That's a term you hear all the time, and they are things like needles and syringes, lancets, auto injectors, infusion sets, connection needles and sets, scalpels, but they can also be other things, such as razors or utility knives or other blades. If an employee cuts themselves and that blade is contaminated, it's now a sharp and needs to be handled appropriately. Accidental needle sticks, as I said before, are a real concern, not only in the healthcare field, but also for other people. It wasn't too long ago, I was walking my dog down the road I live on and found a needle and syringe laying on the shoulder of the road. Very strange, but I dealt with it and resolved that problem pretty quickly. Even broken glass can be sharps. Like I said, they're all sharps if they're contaminated with blood or OPIM. Sharps containers have certain characteristics. You can see they're all different shapes and sizes here. When I was working at the college in New York, where I was, one research lab used a huge number of needles and syringes, and we gave them actually a 5-gallon size sharps container. We called it the big bucket of sharps. So characteristics, they have to be closable, puncture resistant, leak proof, labeled or color coded, upright and placed in an area where sharps are used. So if you're, that's why you see them in all the rooms in the doctor when you go to the doctor's office. And I'll give you a tip. If you or one of your people find a sharps, take the sharps container from wherever you have it to the sharps. You don't want people carrying a contaminated needle across the construction site so they can put it in the sharps container that's in the job shed or wherever you've got it. Custodians, public park workers, or other workers who come across these needles in public places should never pick them up with their bare hands. You always want to use tongs, pliers, something, so that you minimize the risk of an accidental needle stick. You also don't want to just throw them in the garbage. They really should go into a sharps container. The risk from, for contracting HIV or Hep B or C is pretty low from a needle stick, from a sharps, or but if you're pricked or scratched with a discarded needle or other sharps, you really need to report it and get the post-exposure process underway. One other thing I will say about sharps containers is you can use other containers in a pinch. Laundry detergent bottles are used pretty commonly. You just need to put a biohazard label on them. But once you do that, you need to dispose of them properly. Personal protective equipment. While, personal protective equipment, whether it's protective clothing or gloves or face shield or masks or eye or face protection, don't prevent exposure. They do minimize it. This last thing, resuscitation devices, I threw in here because often you will find these in first aid kits. If someone stops breathing and you're going to do artificial respiration, I've seen in the last first aid class that I took that they're not doing rescue breathing anymore. It's just chest compression. So that reduces the use of the resuscitation devices quite a lot. Regulatory requirements. We have WAC 296-823, WAC, for those of you out of state, are Western Administrative Codes. And this is the occupational exposure to bloodborne pathogens rule. This covers general industry usually. And what that rule says is if you have employees with occupational exposure to blood or OPIM, you must follow the program. Occupational exposure is defined as reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or OPM that may result from the performance of an employee's duties. So that means if it's likely that your people are going to be exposed to blood or OPIM, then this rule applies to you. One thing that I will throw in here is that you want to differentiate between occupational exposure and incidental exposure, which is you don't normally, that's not part of your job duties, and you don't normally, if you're a contractor, construction worker, you don't normally find needles on your sites, but every once in a while you do, once every month or two. DOSH probably will not consider that occupational exposure. However, what I will say is there are about 10 industrial hygiene supervisors and their compliance managers above them who will make that determination themselves. So one supervisor may tell their people, once a month, that's okay. Another one may say, well, if they're finding them that often, they need to be in the program. The code you probably are familiar with is WAC 296-155. And that's the safety standards for construction work. And what does that say about bloodborne pathogens? Nothing. You hear crickets. Because it doesn't reference bloodborne pathogens, 296-823 applies. So the question is, do some or all of your workers have occupational exposure to blood or OPIM? That's the question you have to ask. If they have occupational exposure, then the bloodborne pathogen standard applies to you. If they don't, it doesn't. So, if it doesn't apply, what do you have to do? You still have your safe place tongue-tied this morning. You still have your safe place responsibilities to provide your employees a place of employment that's safe and is free from recognized hazards. You have to provide safety equipment and implement practices that are reasonably adequate to protect the employees. So even if the bloodborne pathogen rule doesn't apply to you, you still should train your people on what to do if they find, needles or there's an injury. Do you expect them to do first aid? They should be aware of the provisions of protecting themselves from bloodborne pathogens. If you do have occupational exposure, then you need to comply with the bloodborne pathogen standard. So what does that mean? Well, you have to do an exposure determination, which is, do my people have exposure? What job classifications, having technical difficulties. So you have to determine, which job classifications in your program have exposure. And then you have to write an exposure control plan, which we'll talk about. You have to provide training, and there's record keeping requirements. You have to offer hepatitis B vaccinations, and the labeling and science may be part of your program, particularly making sure sharps containers have proper labels and keeping your workplace clean. So we'll talk about each of these. An exposure determination, as I said, you need to create a list of job classifications where all employees in that classification have exposure. So do all your framers have potential for exposure? Do your laborers have exposure? And then you have to have a list where some of the people in a job classification have exposure, and list what tasks and procedures they do where there might be exposure. A little complicated, but easy to do. Then you have to write an exposure control plan. This is how you're going to implement provisions to make sure your people are protected and that you're following the bloodborne pathogen standard. So you want to include your exposure determination, obviously. Describe what you'll do if there's an exposure. There's a whole series of things that you really need to be doing if one of your people get exposed. How and when you'll implement the plan. This is only until you've got everything implemented. And then we're going to talk about training. You have to train employees what their risks are and how are they going to protect themselves. You know, do they need to wear gloves? Make sure they know how to handle sharps, that type of thing. When to train. Training has to be free and during paid work time. So you can't say you have to come in on Saturday on your own time and take this training. You can't charge them, and you have to pay them for sitting through it. And you have to do this training annually. And they're more specific with that. You have to do it within 12 months of the previous training, which means you can't train in January of 2023 and December of 2024. It has to be within a 12-month period. Trainer requirements. Trainers need to know what they're talking about, to be blunt. They need to be familiar with the bloodborne pathogen standard and the operations at your facility. And that's whether you use one of your employees to provide the training or you hire a consultant to come in and do that training. There's specific content in that training. You have to keep training records, and they include the following: the name and job titles of the trainees. This is basically a sign-in sheet for the training. That's the best way to generate this information. The date of the training, the name and qualifications of the trainer, a summary of the training program. A hint here is if you're using a PowerPoint presentation, just get a copy of the outline and attach that to the training record. That will meet the requirement for the summary of the training program. Tip: at the end of the regulation, there is a form that you can cut and paste and use as your form, or you can create your own as long as it has all this information. As I said earlier, you have to offer the hepatitis B vaccination. This has to be offered to all employees who are covered by your program. They can decline. They can say, no, I don't want the vaccine. Or they could say, I've already had it. In either case, have them sign a declination form. Again, in the program, there is a text that needs to be included on this declination form. It's in the very back of the regulation. So you can just, again, just cut and paste out of that, or create your own form. Vaccination is usually a series of 3 shots over a 6-month period. Oops. Another technical difficulty. Let's see if I can get there. There we go. As I said, it's usually a series of 3 shots. Although I have heard 2-shot series based on the type of vaccine used, or even 4, which I was doing some research for this. I saw that there's 4-set series. I've never heard of that before, and I've never seen anybody who's done that. It's usually 3 or 2. Make sure you get a copy of the doctor's form that he gives to your employee saying that they've been vaccinated. You want to have that for your records to prove that your people were either vaccinated or that they signed a declination form. You also need to control employee exposure. Using proper equipment, make sure they handle sharps properly. Again, this using the tongs to handle them to put into a sharps container. Other practices, that's company and job specific. I can't really give you a lot of advice there. It could be job duties, what to do, training your people specifically, what you want them to do if they find a sharps. Do you want them to go get the sharps container, or is one person designated to do this? That is up to you as a company and employer. Labels and signs. Containers with blood or OPM must have the blood-borne pathogen label, the biohazard symbol on it. For construction, this is probably the only time you'll see this. Other industries may have areas where they need to put up signs so people know that there are biohazards in that area. The labels have to attach securely. You don't want them falling off. Red bags or containers may substitute for labels. I would, in my personal opinion, this is not a good substitute. In Washington State, you can find red bags that stores may use, and that adds a level of confusion. Because of my background and experience, I will tell you that in New York, red bags are automatically considered to be biohazard bags. Stores don't use red bags. Companies don't use red bags. If you see a red bag, it's biohazard bag. And anything that goes into a red bag is considered contaminated and a biohazard. As I said, some industries may have signs posted at entrances to work areas, research labs, medical facilities, you'll see this. Keeping your workplace clean and sanitary. Always a good idea. Every job site should be clean. Clean and decontaminate after exposure to blood or OPIM. So if someone cuts themselves on a saw and there's blood on it, don't just hit it with the garden hose. You need to clean it and then decontaminate it. Use an appropriate disinfectant. A 10% solution of bleach works. A lot of people now are using quaternary ammonia disinfectants. You see those from some of the big custodial supply companies. There is some research coming out that says there are some problems with these materials. Not a lot of research. No warnings have been issued that I'm aware of, but these are the two most common types of disinfectants you'll see. What to do if exposed to blood or OPIM? Personally, if you get a needle stick or whatever, wash that area, wash the cuts with soap and water. Flush splashes to the nose or mouth with water. You can use saline. It's a good use for those little squeeze eye wash bottles that DOSH does not consider compliant with the emergency washing rule. So you could use those. Report exposure to your supervisor. This is important because as a company, they have responsibilities to implement post-exposure procedures. And schedule a visit to the doctor as soon as possible. You can do that as an individual or the company may do it. What to do for an exposed employee. So now this is the other side of the coin. Offer the hepatitis B vaccine if they haven't had it before. Well, offer it if they've had it before. The doctor may or may not want to use this. The hepatitis B vaccine does have some effectiveness after exposure. Arrange for a medical evaluation of any exposed employee. Send them to the doctor. This exam should be confidential at a reasonable time and place and free to the employee. This is an employer responsibility. So if you're working in, say, Centralia, you want to send them to someplace that's fairly easy to get to. You don't want to tell them, well, you have to go to Harborview. It needs to be a reasonable time and place. You want to keep the confidential medical records that you get from the doctor. Part of that medical evaluation will be testing the blood, both of the employee who can actually decline to have the blood sample tested. They don't want to know. They can say, don't test the blood. The doctor will draw it, but they can say, don't test it. And if they do, the facility has to keep it for 90 days. If the source of the blood is known, which in construction probably won't be, if you know whose blood they were contaminated with, ask that person for consent to test their blood. They can refuse. But if they consent, you want to give the test results to the exposed employee, peace of mind. Oh, you were contaminated with employee A's blood. We had it tested, and they don't have any of the diseases you would need to worry about. If you do tell them those results, you also want to stress that this information is confidential, so they don't want to go, be around blabbing that they were contaminated with employee A's blood and, put that kind of information out to the general public. It needs to be confidential. You maintain records. As I said, you need to keep records. Exposure records are confidential, so someone in your company needs to be designated to maintain these records. They need to be secured, in a locked file cabinet or some such thing. So hepatitis vaccination and post-exposure evaluations are both confidential. Any healthcare provider's written opinions about post-exposure, or if they say that, make a recommendation that a person should be vaccinated with hepatitis B vaccine or not, those things need to be maintained. Any information provided to the healthcare provider as required also has to be maintained. These have to be maintained. You have to keep these records for 30 years after that employee stops working for you. So this is something you need to think about and make provisions for. So, winding things up, things to think about. Are your employees or your workplace subject to the bloodborne pathogen standard? Do my people have occupational exposure? Do we have a program in place if we need it? Are we following the program? It's not uncommon for an inspector to go into a business and ask for a program, and they pull this dusty, dingy binder off a shelf where it was put 20 years ago and it's never been taken out and looked at since. So you want to make sure not only you have a program, but that you're following it. If you're not subject to the bloodborne pathogen standard, should you be doing something additional to protect your employees? Again, are you talking to them, training them about what to do if they find a discarded needle, that type of things? Do any of your employees need additional training? Have they picked up a needle with their bare hands? In a case like that, you want to train them about what they should be doing, because they obviously are not aware. So, questions. I will open this up for questions. Wow, crickets.